Tell you about the future of digital health. Give it up.
Hey guys, great to be here. So my name is Ron, as John introduced, and I was the co-founder and lead at MedHacks 1.0 last year. So by quick show of hands, how many people here are studying computer science?
Woo!
Okay.
Can you hold the mic a little
to add on to that, how many people are
closer
either not very interested in health or think that they can't really make an impact in academics? Okay, some hands. That's cool. So anyway, MedHacks we think is very different. And to start off, it's a huge problem for this reason. You see that red line? On the x-axis, we have the per capita healthcare spending in international dollars, and on the y-axis, we have life expectancy. And as you see, the US spends way more than anyone else, and we don't get better results. And the problem with this really is that the patients, providers, and payers in the medical system in the US are not linked in any rational economic manner. And essentially, that our healthcare system doesn't focus on innovation and improvement, which is terrible. So, with hackathons and health, right? So I study biomedical engineering and computer science at Johns Hopkins. And you see, doctors, right, they have a lot of really good domain expertise, but technology is a little bit foreign to them, and they don't always have the best resources to innovate. And on the other hand, you have this hacker community, right, which has so much energy and is always learning and moving fast, but doesn't necessarily work in the health field, which we saw as a really big problem because the hackers, as you see, there's so much energy here, there's so many people who can innovate here. So what we really wanted to do is we wanted to bring the hacker spirit to health. And essentially, MedHacks is kind of built upon these two principles that, one, you don't need to be a doctor to hack health, and two, anyone can do it. So going on to the next slide, this is Silicon Valley, right? And last summer, this is a bit of an unpopular opinion, but I spent a lot of time in the Valley seeing what people were doing. And most people are just working on simple web apps and simple mobile apps, which, you know, when people say, oh yeah, I'm gonna go to this hackathon and learn something, they're referring to, yeah, I'm gonna learn Ruby on Rails, but I'm a computer science major. And really anyone in the general CS population can do it. Like around 95% of the work done in Silicon Valley can be done. I thought I was a 95%er, that's me with Jared and Dinesh on Thursday. Unfortunately, I am not in the Pied Piper, and I cannot do crazy algorithms. But you can make web apps. So what is MedHacks? MedHacks isn't really the solution to this whole healthcare problem. It's an embodiment of the solution. In the current paradigm, only doctors are allowed to innovate. But looking around, there's plenty of innovators in this room. And we live in this world where there's no boundaries anymore to where you can innovate. Someone who's being a developer in fintech, that doesn't mean that they can't be a developer anywhere else. And essentially, what we did is MedHacks is our experiment on this thought that you don't need to be a doctor to hack health, and that anyone can do it. So what we did and what we learned, so these were my opinions, but here's an actual experiment, which is MedHacks 1.0. So these are all the areas of study. It's a pie chart of all of the different majors at MedHacks, and you see, like, there's a lot of computer science, but there's also a lot of biomedical sciences. There's people from all over, which is really crazy. The other really shocking statistic that we were surprised to see was we almost had a 50-50 split. And if you heard the last talk, diverse teams really are the ones that win because they're the ones that generate the best ideas. So on to the teams themselves. People always ask, what do people build at MedHacks? Well, MedHacks is like a regular hackathon. You're just building things that are relevant to healthcare and technology. So what we found was these most diverse teams actually did the most successful. So on the far left, there's LeapMed, which was a group of freshman biomedical engineers and computer science majors who raised over 10K in seed funding. Essentially what they're doing is they're solving the problem of in-home carpal tunnel therapy. There's ID-Ear, which is using computer vision to detect ears, kind of like for fingerprints, and is undergoing research studies in global health settings. And there's deep vein thrombosis, which is a huge problem in hospitals. And this team of doctors, engineers, computer science majors, they all came together in this one weekend and built this crazy device that could actually detect it with accuracy. So in terms of scheduling, MedHacks kind of goes like a regular hackathon, except on the Friday. So on the Friday, people come in, they have their dinner, but they're greeted with these two keynote speakers. And this year we had these two awesome speakers. One was Dr. Elaine Mabuik, who leads the Global Health Initiative. And what he talked about was how you don't need the FDA for all of these different things. He showed all these mobile apps that are affecting millions of lives, and people just don't know about the problems in global health. And then Gabriel Ott also talked about, our second speaker, he talked about how you can run a biotech company, like a tech company. So after those speakers, what we do is we put people essentially in one room, and we get them to pitch problems. And what we try to do on MedHacks is we try to make things very problem-focused. So essentially someone would be going up like this, right? And they'd be going up to a microphone and be saying a problem that they could see in health. So this could be a doctor, this could be a regular student, it could be anyone with some interest in health and who sees the problem. So if we go back to the schedule, then we essentially keep everyone in this room and they come up with solutions and they form teams around the solutions. And part of the way that we try to inspire this interdisciplinary innovation, because as you saw, the teams with the most diversity, one is we had these shirts, right, where people wrote what they identified with most. And this was a really great way to show everyone that we were all here for one goal. And people really identified with this. So in short, people came together and they came up with these great solutions. And the goal of bringing these doctors and business people isn't for them to pitch the solutions. It's for them to pitch problems and then they continue on like a regular hacker would. So you have your medical students who learn these web frameworks or mobile apps over a weekend, and they do just as well as regular hackers at hackathons. So enough about how cool I think MedHacks was. This talk is for you and for you to get something out of it. So at first when we were starting MedHacks, something that everyone told us was what we were going to get was an intersection of these two sets, like people who are interested in biology and interested in computer science. I went to plenty of people originally, they said, Ron, you'd be the only person who'd be interested in doing something like this. When really it was the exact opposite. We got the union of sets. We got a bunch of people who were in computer science and really longed to make an impact, and we got a bunch of people in biology. And this was really exciting because essentially we came up with this specialized idea, but it ended up being a monopoly in a sense. You get this great diversity, which people are striving for. The second thing that you can implement, and this doesn't even need to be themed, but you can do these problem pitches and solution pitches. And this is relevant in the sense that I was talking to someone from MedHacks the other day, and they said, I've seen 12 apps for scheduling showers in the morning. And it's kind of unfortunate. There's so much talent that they can be used in a better, more thoughtful way. So the next thing we did was we told everyone. We didn't just hit up the computer science majors in the department. We didn't just hit up the engineers. We had physical conversations with people in the School of Medicine, people in public health, and we showed them why MedHacks would add value to them, how their problems could be solved, and why it was exciting. And that's how we achieved our diversity. So the next thing is you might see this and you might implement these ideas and you might start having like a holier-than-thou mentality, which I really don't like. As one who has been at many health design innovation challenges, there's always like this one person who says, yeah, these little kids are just trying to build Snapchat and their mobile apps and they're not adding value to the world, which I totally disagree with because like all of these apps are adding a lot of value. But essentially with these ways, you can kind of shift your hackathon in a different way. Something that is perhaps more thoughtful, but not necessarily better. And it doesn't need to have that mentality. Hey. One sec. Yeah, in conclusion, these diverse teams are the one that wins. And if you just show people that the areas that are more accessible to engineering, and kind of funnel them into hackathons that way, you can have a lot of success with getting retention, with getting new people, with getting people to actually realize what's really great about the hackathon, not just a celebration of computer science majors. So as the final point, you don't need to be a doctor to hack health. You don't need to be a teacher to change education. You don't even need to be a hacker to change technology. But most generally, you don't need to be an expert in any given field to make an impact on it. And yeah, so there's my email. Feel free to shoot me anything.